Hello and welcome to Well with Del. I'm your host for the program today. My name is Dr. Jerry Del Canton. On our program, we like to give you topics and talk about things that will help you live a healthier and happier lifestyle. Today's program is called Injuries, Ice or Heat, and What Not to Eat. Now, before we talk about what foods to eat and whether we use ice or heat following an injury, it's important to understand what inflammation is. Inflammation has 5 cardinal signs. We have redness, heat, swelling, pain, and loss of function. Now, it's pretty easy to meet those criteria after an injury, but those 5 cardinal rules or signs are usually the ones that we look for most following some type of an injury. So what is inflammation? When there's an injury in the body releases chemicals to that area. These chemicals are known as mediators or inflammatory mediators to help the body heal in that area. The blood vessels are also dilated so that more blood can rush to the injured area and heal faster. That's why sometimes you'll feel it's warmer or it looks red, and that's because of the increased blood flow to that area. What's more, these chemicals will irritate the nerves and send a signal to the brain, initiating the pain response. This is important because when our brain knows that we have an injured area, the body's going to protect it more as to not allow for further damage to that body part. As you can see, inflammation is a good and necessary part to heal the area that's injured. The question then is asked, why do we try to reduce inflammation? Well, when these inflammatory agents and these chemicals rush to the body part, oftentimes there's too much fluid in that area. The sheer volume of fluid that rushes to that area can actually cause more damage to the already damaged tissues. So what we need to do is we need to help reduce or manage the amount of inflammatory response, because the body, though it is very resilient and it's amazing what it can do, it does sometimes need some help with reduction of inflammation. And it's very important to understand how to do that the right way. And that's where we're going to talk about the difference of ice versus heat. Now, you may have heard of the old acronym RICE, which is rest, ice, compression, and elevation, or even the new modern term of PEACE, which stands for protection, elevation, avoid anti-inflammatories, compression, and education. But I'm a firm believer that those first 48 to 72 hours after an injury, there's nothing better than ice or cryotherapy, as we sometimes call that. With ice, the most important thing about the ice is you want to make sure that you're applying it for the right amount of time in the right location. You also want to make sure that you're not going to burn yourself. If you use ice longer than 15 to 20 minutes, longer than 20 minutes, the body starts to look at it as a deterrent and actually does the reverse effect, which is going to be to increase blood flow and chemicals to that area. We have enough already there. We want to start to get some of it out and limit how much of these anti-inflammatory agents are there. So we really want to make sure that we're using the ice on the area 15 to 20 minutes, and then let your body rest for a good 45 minutes to an hour to let the body get back to the normal temperature before freezing it again. So ice is going to be very, very important those 48 to 72 hours after the injury. When to use heat? Heat is a little bit of a different animal. You can use heat best on stiff, sore, achy joints, arthritic joints, tight muscles, but never when there's swelling present or inflammation present. You want to use heat as just a way to loosen up muscles. Very good to use before you work out, before you go on your walk. Use it for those things. As far as for migraine headaches and tension headaches, a lot of people like to use heat. I'm a firm believer that ice works best in that. When it comes to the different types of headaches that you may experience, you may want to try ice first and then try the heat at a different time and see what works best for you. I found that most patients seem to do significantly better with ice at the base of the neck, the base of the skull. That seems to reduce their headache significantly better than any other modalities such as heat or ice. You may have noticed when I used the PEACE acronym when it said to avoid anti-inflammatories. One of the things that you should know is the way an anti-inflammatory works. So that is your Motrins and your ibuprofens and your Advils. And we talked about those chemicals that get released to the area of inflammation. Those areas, or those chemicals that get released into that inflammation, also have something called prostaglandins, which is one of the main primary components of inflammatory agents that rush to that area. When you take an NSAID, which stands for a non-steroidal anti-inflammatory, when you take an NSAID, such as the Motrin, the Advil, any type of the ibuprofens, you're going to reduce the production of prostaglandins. And while that sounds great, but prostaglandins are also very important in other parts of our body, namely our digestive tract and around our stomach. We want to make sure that those buffering cells stay big and patent. When those production of those cells start to go away, and that's why you may have heard people that have used ibuprofen too much or for a long period of time, they've developed some stomach problems or some GI problems. That's because of the overuse of the NSAIDs. Now, if they're used appropriately for a short period of time, I don't recommend my patients use them for more than 2 or 3 days. But if they're used appropriately, they can be effective. But you can't rely just on the bottle of Advil, because it's going to cause you bigger problems down the line, and that's how it has a negative effect on the prostaglandins that we have in our body. So being that we're talking about putting the right foods into our body, we're going to talk about foods what not to eat. The first food we want to avoid is cheese. Cheese is undigestible by almost 60% of people in the United States. It's because lactose, which is its primary sugar, is undigestible, and people have a lot of problems with that. Primarily, we want to avoid cheese that are high in salt or processed cheeses. Those are things that are going to definitely increase your inflammatory response and going to reduce how quickly you improve. The other thing that we want to really avoid is margarine and any type of vegetable oils. They're very high in trans fat, and we know that they're not healthy for us, and they're found in a lot of products. So if you're having trouble getting back following your injury, you might be adding some foods in there, such as the margarine or the vegetable oil that you didn't know that it's in there. But it will definitely exacerbate and make worse the inflammatory problem that you're dealing with. We really want to watch the salt intake. We want to watch these artificial sweeteners like aspartame. When you become more in tune with your body, and if you're a label reader already, then you're probably pretty in tune. When those things go into your body, they're not natural. They're not something that the body wants in it. So you may get a headache, or you might not feel yourself. You might be a little sluggish. You want to avoid all the artificial sweeteners. So be a label reader. See what is in there. Look for your sodiums. Look for the nitrates. Look for the MSGs. Look for the aspartames. Avoid those things at all costs, especially when you're trying to heal. So this is just a few of the foods that you do not want to eat, some of the ingredients that you do not want to have in your diet. So if you want to find out more about that, you could do a search for inflammatory foods. There's a lot of different lists out there, but we wanted to pick the biggest ones that we think would help you today. So we want you to avoid those as soon as possible. In the future, we will be doing a topic on which foods we should be eating that also do help with inflammation. So stay tuned for that in the future. We will come back to that. So to recap what we learned today: ice and heat, when to use it, when not to use it. Short recap: ice should be 48 to 72 hours minimum following an injury. You learned the 5 signs, the 5 cardinal signs of inflammation, which I think that's pretty self-explanatory. You can tell whenever you're inflamed, when you have pain, loss of function, redness, some heat, some swelling. Those are the signs that you want to look for. We also learned about how long we should use ice for. 20 minutes maximum, off for an hour before you refreeze your body part again. Also, make sure there's always a barrier between your skin and the ice. We want to make sure that you don't burn yourself, because you can burn yourself. Also, don't go to bed with an ice pack. Don't fall asleep with it, because the body will also, after 20 minutes, after 25 minutes, the body will start to look at ice as a deterrent and actually cause a negative effect and increase that vasodilation, increase the amount of chemicals that are rushing to that area. And we've learned we need to get them out of there. We need to reduce that volume of those inflammatory agents that rush to that area. So very, very important. Don't forget to take it off. Put it on for 20 minutes. Make sure you take it off for at least an hour before you use it again. Now, in terms of heat, you can use a little bit longer with heat, but remember, you're going to be using heat not when we're in an inflammatory state. These are going to be for arthritic knees or sore muscles or things that you want to loosen up. Heat is not something you want to put on immediately following an injury, because once again, what heat does, it's going to vasodilate the blood vessels. It's going to allow for more fluid to rush to that area. And as we talked about earlier, just the sheer volume of more fluid to an injured area is going to cause more stress and strain and harm to the already injured tissues. So I always like to tell my patients, when in doubt, use ice. You can't go wrong, but make sure you only use it for the allotted amount of time, which is up to 20 minutes, and then remove it for at least an hour. We hope you enjoyed the program today. We hope you learned something from it, and we'll see you next time.